we're live.
Hey guys, coming close. We're doing one of our favorite things today, male facial sculpting. You guys know that's one of our expertise here. And it's important to go to somebody who's experienced with this, not only because the underlying anatomy, there's blood vessels and nerves, but also because the guys that come to me want enhancement, subtle feature enhancement. They don't want to look just better. And so we have a young looking, really good looking guy, but his face doesn't have a lot of definition on the lower part. And even here, you know, it's nice to, he's got a longer face like me. We want to give it some structure. So if you look up a little bit, I want to show you guys, he's got a nice jawline, which is already pretty tight. But if we project the chin and define the angles of his face, he's going to look more defined. And that's our goal. So I'm have you come over to the front. We're going to start with projecting the chin. Don't get too close. You want to show it from the front side. A little bit more. We're going to go right on the bone. We're using Radiesse, which is a calcium-based filler. There's numbing in here, so it's going to feel a little stingy at first. This is the first time he's ever had anything done, so he's doing really well. We're going all the way down. It's really important you understand the anatomy here. This is like doing an implant. If you were to do a chin implant, it would actually be under the muscle on the bone. That's exactly where this filler goes.
It doesn't hurt at all.
How was it?
Easy.
So far?
Mm-hmm.
Good.
Why did you want this filler? Facial sculpting?
Why did I want
Project
that?
your chin, masculine.
Yeah, hold on, let me do this and I'll ask him a couple of questions. In between, it's actually good. The studies show that if you go slower on injection, take your time, it's less bruising and swelling typically. But you know, we have to go to sensitive areas. You're going on the bone, you're going through muscle. And again, this is a nice filler for this area because it's thicker, it has substance, and it can give good projection. We're also doing not only the deep portion, but we're doing what's called the lower cutaneous lip because it gives more boldness and definition. So go ahead, tell them, why did you want to do this?
I just wanted a much stronger, more masculine jawline, a bit more definition, not having to rely on facial hair to give me a stronger jawline.
Yeah, just to give you that like enhanced look.
Mm-hmm.
He works a lot. You're gonna have to switch sides. He works a lot, and he just, you know, working late long hours and stuff takes a little toll on the face.
Mm-hmm.
Okay. So again, we're following his jawline. I'm sure people are saying so. What are they saying?
Yeah, Dr. Garcia says it's nice to catch you live.
Finally, we've been waiting. Perfect. So now what I'm going to do, once I've balanced now the chin, we've given it a little projection and some strength, and now we're going to go to the jawline. Make sure it's completely.
Why did you start with the chin before the jawline?
Because what I like to do is balance the nose to lip to chin ratio, and then widen here. If you widen this, it looks cartoonish if you don't have enough filler then in the front. So right now we have a nice projection, we have a nice width. For him we went a little bit wider because if you actually draw a line from his cheekbone, that now gives him the angle. So I want you to look all the way up and a little to your left. We're gonna go right to that 90-degree angle and just do small little bits. This is a different type of technique. I call this a micro droplet technique. Some guys I like to do this, and PJ, you're gonna Q-tip this for me to give it a little bit more structure without it looking too bulky.
SXZ Alpha says that they love this type of facial sculpting.
So do I. Thanks for following. So we're doing a little bulk really at that 90-degree angle. Since this is the first time he's having this done, I want to focus very particular. So PJ, come here and have you hold this and do Q-tip. So we do a different technique there. And then yeah, you roll Q-tip down.
Dror Cohen is asking, when can one see the final result? Is there a downtime due to visible hematomas or other edemas?
Well, we really shouldn't get too much hematoma. If you look at the chin already, almost no bruising. Now I'm gonna have you turn the opposite way. Same thing, chin up. We're gonna follow that 90-degree angle. You will see the result immediately, but again, there's fluid injected in here, so obviously it builds up a little bit more. I always tell people about 10 to 14 days is really when you see the final outcome, and then you can always add. Right now we're creating that structure. Now some people like to add and come back posteriorly a lot more. I actually like to follow the person's natural anatomy.
And they're asking, what's the total volume injected?
And we haven't finished yet, so we'll see. So far we did 1.5 syringes on his chin, and we did half a syringe each side of the jawline. Go ahead and switch to the main page now. You can see it's starting to form. I'm gonna have him come over here. Okay. And we're gonna go back and forth. It gives the numbing a little bit of time to kick in. Taking our time. It's always good. You don't want to rush. No rushing needed. You want his face to look perfect when we're done. So we're already starting to see it. If you guys see here, there's more of an angle here that's being developed. This is wider and more projected. So now I want you to look up again. Bite down for me a second. Okay, good. Relax. You guys can see the filler bulking there a little bit. Now in the US, we have different types of fillers. Look up again a little higher. For different purposes. This one's going to give him a little more bulk.
They're saying that his face is coming together already, even though he looked good before.
That's exactly right. We did. I don't want to overdo it. Now I'm going to do a touch right to the cheek area. It's going to feel a little weird. To balance what we've just done in the jawline. One more poke, not that much. Very little. Okay, if you just switch now. Good. Sorry, guys. It's really starting to come together.
Mm-hmm.
I'm so excited to see it.
He's gonna go crazy. So now we're gonna balance. Go ahead and look up again. Good. So it always looks a little bit bigger when we first do it, a little overdone, and everyone freaks out. Not my patients, the people viewing. And then I tell them to chill out and wait a couple weeks. It'll settle down, and then we decide, do we need any more or not.
Everyone wants to know how old the patient is.
What do you guys think? He's about 18 to 20. Looks so young.
Saying he's 20-something.
Well, he's young, okay? We're not gonna we don't give away our ages
Yeah.
here. Okay, come back a sec. Good, stay right there. And then again, we're gonna do just a subtle bit, and then I'm gonna take a look. Good. Alright, go ahead and hold there. We'll look from the front. We'll look at all angles, and then I have my little left over for touch-up areas.
I know we're using Radiesse, but could sculpture be used for
Not
jawline
really.
enhancement?
Sculpture's really not that great for jawline enhancement, especially in men. They really want to see, okay, lay back so I can wipe everything off, because I need to take a look. I need to really take a look and make sure the angles are what I want. So we're gonna take a look right now. So you guys can see already that 90-degree angle is much more defined. Take a look there. Look at his chin being more projected. I want to pinpoint that. And then his cheek having a little slight enhancement at the angle, lateral angle, or this, what I call the spotlight for men, which is right here. So we're going to do another very small amount. Good. And looking me straight again.
Is the Radiesse diluted?
It's not diluted, it's mixed with lidocaine. So we don't call it diluted, we call it mixed. And yes, we always mix it with it because, bite down again. Good, relax. Okay. Let's go to the other side, we're doing our fine tuning. So now we have the angles here, let's do a little more angles here.
And how long will this filler last?
Radiesse lasts about 18 months, 12 to 18 months, but what I find in most guys that do this, within a month, they always want a little bit more. So we'll take a look and decide in the next couple weeks to a month what we want to do to keep building out. Look up again. There we go. To keep building out the jaw and give them a little bit more. And right now, again, it's going to look a little bulky. Okay. Let's wipe them down. And we'll look at our final result. Hold on. And let's do an Emer reveal first. So you guys know, what's the Emer reveal?
It's when we give the phone over.
So we give the phone to the patient and we let him freak out first, okay? So give that to him. You want to keep your head up so you can see.
Oh, I love it.
So what do you think? What were you looking to achieve?
Definitely looking to achieve more projection and sharper lines.
Right, so definitely look at 90-degree angle. So turn your head. You can see here, look, much more definition at the 90-degree angle, which is great. When you look straight, bite down so you can see the angles a little bit. And the projection here, we kept it a little wider because that fits your face. A little enhancement right up here in the cheek area to balance everything in the jaw, and then look at this side. The key, you guys, is to see this spacing right here. This hollowing should be just a little bit so that it really gives you the feature enhancement. How was the pain?
Fine, I can't feel it at all.
Well, what do you feel right now?
A little bit numb in the chin.
Yeah, that's typical. So let's switch it back and give them the mirror, because I feel like looking in the mirror gives you a little bit different perspective. I'm going to raise you up. Put your head back. Perfect. Now take a look. What do you think?
Really good.
Amazing, right? And what, were you nervous before or no?
No, I've wanted it for a long time.
He has wanted this for so long, you guys. And he said he's like finally willing to do it. Was a little nervous, don't let him. But we got a really good result. So I think, again, widen this a little bit with some projection. Gave you a little more at the angle, and then that slight little bit there. What do you think?
Perfect.
All right, you guys. So he's been Emerized, male facial sculpting, jawline, chin, cheek. All those anatomical areas being subtly enhanced. He'll give you updates in the next few weeks, and then we'll see how he's doing. And if we need to do any tweaks, we'll do it in the next couple weeks. Bye, guys.